Hello, hello. How are you? Morning, everybody. Apologies, we're running a bit late. Hello. Yeah.
Hello, hello. Hi, Louis. We are running a bit too late, but we're going to commence in a few minutes' time.
Yes, I'll use it. Yeah. Afternoon now. Good afternoon, ladies and gentlemen. My name is Thabo Masebe. I'm the spokesperson for the Gauteng government. We have called you here to this briefing so that we can talk to you about our comprehensive plan, and then we'll hand over to the MEC for Health, Dr. Bandile Masuku, who will take us through the various measures that we have adopted to deal with the pandemic. And then from there, we will take questions from the media. Then we'll be able to answer all your questions. I'm going to hand over to the Premier immediately.
Thank you very much. Ladies and gentlemen. I'm not sure if it is okay. Can I? Yes. Okay. Thank you very much, Thabo. Good afternoon, ladies and gentlemen from the media. Today we are doing a briefing of how the Gauteng provincial government and the municipalities are going to implement and enforce the measures to curb the spread of COVID-19 in line with the announcement made by President Cyril Ramaphosa on Sunday. We know the World Health Organization has declared coronavirus outbreak as a global pandemic, and President Cyril Ramaphosa on Sunday announced comprehensive measures as our country's response and declared a national disaster. Gauteng is the most vulnerable province as a result of a number of factors. Firstly, we are a port of entry with regard to aviation, and we know that aviation has been a significant factor in the spread of coronavirus globally. Our province is also densely populated. We have the highest population in our country, 25%, or 1 out of every 4 South Africans live in Gauteng. Our public transport system transports millions of people on a daily basis, and we also have densely populated human settlements. We have people who travel from across the country into our province on a daily basis, if not on a weekly basis. But we also have significant number of people from across our continent who come particularly into our province from the SADC region. And this makes our province, as I said, vulnerable. OR Tambo International Airport is in Gauteng, as well as Lanseria Airport. So as we speak, we have the largest number of reported cases. MEC Masuku will deal with that in detail later. So we have to do what we have to do and possibly do much more to ensure that we contain the spread of COVID-19 in the different areas of Gauteng. On Monday, I convened the Provincial Executive Council, that is otherwise known as the Provincial Cabinet. We extended the sitting of our cabinet to the district and metro mayors. It is in that meeting that we discussed extensively what we need to do in Gauteng province, department by department and municipality by municipality. We have also undertaken a number of engagements already, consultation processes with the unions. The meeting took place yesterday, which was chaired by MEC for Transport and Infrastructure, MEC Mamabulo. And then you will hear a little bit more about that. We have been making sure that the whole of the provincial government is also prepared, because if you want to deal with the outbreak of an epidemic or a pandemic, your public servants are your first line of defense. So it's very important that the public service itself is ready. We have been communicating with our national government and in many areas receiving further directives, including from the Department of Public Service and Administration, on how we must handle administration under the circumstances. We will introduce a number of measures in consultation with various sectors as well. MEC Mamabulo also met with the taxi industry yesterday as it pertains to the mass public transit system in our country. We have huge, densely populated public transport corridors that move large number of people across Gauteng province. I will tomorrow meet with the leaders of the political parties in the Gauteng legislature to ensure that also at the level of the political parties that are represented in our legislature, we move at one. It is very important that we mobilize various sectors of society. A pandemic is not something that can be addressed just from the point of view of government. We need the whole of society. I've also been in discussion with some of the private sector leaders whose major operations are based in Gauteng, and many of them have been offering to do more than just looking at their own businesses. And I will meet with them on Friday. And also on Friday, I will meet with the religious leaders or leaders of faith-based organizations. They are meeting tomorrow on their own to generate a response, but many churches, institutions, religious institutions have already taken steps, and we welcome that. They have already announced the Easter weekend is one of those focal points where large sections of people gather. They gather in our province as well as in other sites across the country. But we know that the people of Gauteng move in large numbers during Easter to the different parts of the country. So that's one of the important things we are also planning for that mobility during the Easter weekend. And the detail that will be outlined in the plan here will indicate what we're going to be doing. Lastly, I want to announce the team, the COVID-19 Executive Council Steering Committee that is going to be leading us in this fight. That team is led by MEC for Health, Dr. Bandile Masuku. That's why it's him who's going to explain the detailed measures we have agreed with various municipalities and various stakeholders across the province, which we are going to implement. So Dr. Bandile Masuku will be the principal provincial government spokesperson on COVID-19. So not just for health, but for the whole of government response, including the measures we are implementing in the municipalities, which he will speak to in the short while. Included in the team will be the MEC for Sports, Arts and Culture, MEC Mbali Shope. There are many sporting events in this province that take place, and including arts and culture events. They are the nature of our province. She has also been consulting with the sporting and cultural and creative industries on that, so she is part of the team. And then on the extreme right, I have MEC Jacob Mamabulo, the MEC for public transport, because public transport is a major area of risk in the spread of COVID-19. The DG of the province, Ms. Pindile Baleni, will provide administrative support to the team, because we want to marshal the whole machinery. All public servants in Gauteng will also be taking direction from this team around how government is going to operate during this period. We need extraordinary ways of continuing to provide services to our communities and ensuring that the public servants themselves are protected as they do this. On my left, I have MEC Maile, the MEC for Cooperative Governance and Traditional Affairs, dealing with local government and disaster management. So because this has been declared a national disaster, it does fall under his immediate responsibility, but also ensuring that municipalities adhere to all these measures and supporting the weaker municipalities that may require more resources in order to enable them to respond adequately and appropriately. Next to him is MEC Mutara, MEC Tasneem Mutara is responsible for infrastructure in Gauteng, but she's also responsible for occupational health and safety. So the issues pertaining to what will happen to all government buildings in Gauteng, and how do we make sure that all offices and spaces where public servants are going to be interfacing with the public or just working amongst themselves, that those buildings are compliant themselves in terms of how many people can go into some of our facilities, and ensuring that the sanitizers are available in those facilities. So from a point of view of occupational health and safety, MEC Mutara will be key. But we also are looking at should the outbreak lead to a point where there are more people who need to be admitted, the current facilities, our hospitals and community health centers will not be enough, because she's responsible also for government buildings. And if we have to add or procure an additional facility or negotiate with private sector to make available additional facilities for treating those who are infected at whatever stage of infection, once people have been diagnosed as positive at whatever stage, and if they need treatment, and at some point if they need admission, including quarantine, because that's one important additional issue. She will be responsible for helping the Gauteng provincial government and the municipalities to ensure we have additional facilities. We want to have, at least in every metro or district in Gauteng, we have five district stroke metros, 3 metros plus 2 districts. We want to have an additional facility beyond the current hospitals and community health centers, either for quarantine or for admitting additional numbers should the outbreak get to a level which we're working very hard to avoid that scenario. That's why we must enforce all the measures. That's her focus, to help us ensure that the institutions of government are compliant, the public servants themselves are provided with the sanitizers, but those who have to come face to face with those who may be infected are also have protective clothing. The last colleague is the MEC for Community Safety, MEC Faith Masbuko. MEC Faith Masbuko will principally just be responsible for enforcement. This has been declared a national disaster. We want every group in society to be complying, that there should be no people who are more than 100 who gather in any part of the province. The good thing is that there's a very positive response from different groups in society. There may be 1 or 2 cases where, like we have been to court on one case of the family where the family was not cooperating, but in many instances we want resorting to having to get the law enforcement officers to shut down a place or shut down a church or shut down an establishment where people are just not complying is something we will do. I must say that we will do, but we prefer to say to various sectors of society, business, civil society, the religious sector, everybody, we prefer to work with you, to work with citizens to protect ourselves, because this is about protecting South Africans, protecting the residents of our province, which is the most vulnerable province, as we have said, by enforcing the measures that have been put in place. So the MEC will be working round the clock with law enforcement officers, and the comprehensive measures that we have agreed upon will be announced by MEC Masuku in great detail in a short while. So this team, at the back of this team, there is what is called the Provincial Command Council, which I will convene. like the President is convening the National Command Council. This team works on a day-to-day basis, but twice a week I will convene the Provincial Command Council, which is made up of the whole Executive Council and the mayors of the district and the metro municipalities in Gauteng. And additional players who are supposed to be there, law enforcement agencies, will be part of the Command Council. On an ongoing basis, we will be engaging with various sectors of society. And one of the things I want to say is that we are already seeing that there are two areas already where people are panicking. The other is about people rushing to go and buy in order to stockpile food. We want to say to the people of our province, there's no need to do that. That level of panic is not necessary, because we are assured, we are working with our national government, we are assured that they will, our province will not run out of stock of food. But if people behave like that, they triggering what is not necessary. The second area that I want to address this morning is I see this panic. People are now streaming and flooding into our public facilities, as public health facilities. People are rushing to hospitals. Even those who are not likely to be exposed to this virus are all rushing to the facilities, our facilities. That level of panic will outrun our facilities. We will not be able to manage large numbers of people who are streaming into our hospitals, as it is beginning to happen now. So I want to make a call to the people of our province. The MEC will announce what we are doing in all our clinics and our hospitals, and where are we prioritizing who to be treating, who to be screening. But people must not rush in large numbers. Just this morning, the officials, our management at Chris Ani Baragwana was reporting that the numbers that have come at the hospital there are extraordinary. And everybody is arriving there regarding themselves already as infected. There are guidelines that Dr. Masuku will talk about how is the whole world dealing with screening and testing, so that we don't have a situation where our facilities are outrun by people who may not be infected. On this note, I would like to hand over to Dr. Masuku to take us through these detailed measures, sector by sector, area by area, that the provincial government is instituting today as a response plan to the national announcement made by President Cyril Ramaphosa.
Thank you, Premier. The Premier has, good morning everybody. The Premier has explained some of the basic infrastructure in terms of the admin on how the coordination of our response will be done. Over and above that, we also have to indicate that it's work that we have been doing, that we have been escalating slowly in terms of responding as per stage of the virus. So what we have done is that we have started the plans to establish a war room, which the Premier has spoken about, which will help us to do monitoring, surveillance, and also change how we change approaches as we face certain situations. We have also been having a plan to planning the escalation of our services in terms of the creation of more space in our hospitals, in all our facilities, particularly those who are not designated to be the treatment centers, so that we increase the bed capacity that we have as a province when we really need to admit a whole number of people. We also, in a space of escalating the structures or places where we can be able to put a number of people for quarantining, which normally would have been staying at home for self-quarantining or self-isolation. But we know and understand the situation and circumstances of our people, that they might not be able to have that spaces. So that will announce in due course in terms of all the 5 districts as allocated. And we're in a process of negotiating with one of the private companies to acquire 250 beds in the West Rand, which will also strengthen that aspect. We also have had a meeting with all our clinicians across the province, where we're discussing some of the measures that needs to be taken in light of the decongestion that has to happen in terms of our facilities. At the current moment, we are supposed to circulate today. We are going to circulate a circular that will actually outline that we are downscaling our services in terms of outpatient and elective measures. So outpatient is those people who are coming for checkups and so on, and those who are awaiting elective operations will be put in abeyance for almost a month. But it will depend on how we respond. And we're also procuring more test kits, which will make it easier for us to rapidly get results in terms of the detecting and diagnosing the infection. These measures will also just work in terms of us helping us to get outside the issue of containment. But we still want to emphasize that we are going to follow the old preventative measures, that is washing your hands regularly with soap and water, and when you can be able to afford an alcohol-based sanitizer. We also want to advise people not to avoid touching their faces, your eyes, nose and mouth with unwashed hands, particularly after handling or touching any surface. This also includes money and doors and everything else. Also to avoid close contact with people who are sick. The advised distance is 1 to 2 meters between individuals. Also you're advised to cough, have a cough etiquette when you use your flexed elbow, a tissue to cover your mouth or nose for that. Then you are able to dispose it in a bin properly. We also want to make sure that we clean and disinfect frequently touched objects and surfaces. As a public service, we also want to make sure that all our government continues to work, and we are going to put in place all these measures in our government buildings. These also include protective gears that we have. In line with DPSA Circular 7 of 2020, the State of Disaster Guidelines for Containment Management of Coronavirus in the public service, the following transactional and non-transactional operations will be affected. These are operations that require staff to access data and databases on site. Staff that perform functions related to salaries, appointments, and terminations will have to be able to access data on site. We'll also ensure that the human resource service in the province will continue uninterrupted. VPN access will be given to all the staff members. We'll encourage all staff to download the Microsoft Teams applications on mobile and laptop devices. This is a way of trying to make sure that we manage and meet without having to have contact. So through Skype and so on. So this is also a call for us as government to strengthen our ability to enhance online services and virtual services that we have. So we also ask the team leader, which is led by MEC Mamabolo, which deals with labor, and Director General Ms. Baleni in terms of meeting and continuously engaging labor, because that's the most important aspect in terms of this response. The labor is on board, they've been met, and we are intending to continuously have the engagements with them. In line with Treasury regulations, we'll implement emergency procurement, which is responsible of the accounting officers in respective departments, because now we are actually in a disaster period. Procurement should be embarked on to address immediate emergencies. And we are also saying to all the accounting officers that procurement of all protective garments and equipment should be made, and those procurers or service providers who have these things like your masks, sanitizers, gowns, gloves, and everything will make available the information where you can make contact so that we can make them available. The aim is to make sure that we have enough for everyone and we are not going to be able to run short. So we are going to open up that space for everybody. The eGov platform will also provide information portal for COVID-19 statistics and development. We'll also continue to intensify health education campaign in terms of prevention of the spread of the virus. We'll continue to create and circulate widely multilingual communique and adverts in all GPG languages, in all the languages, to educate people about COVID-19. And we'll continue to inform our public in terms of testing sites, prevention, and treatment in facilities. With regard to distressed household, we are engaging financial institutions and other social partners to support and provide relief of households that has got a negative effect to the economy. We also request and track registers of all ECD learners in terms of those children who are going to come with flu symptoms or who have been seen with flu symptoms. We are setting up an emergency response war room, particularly that will assist vulnerable families in terms of shortage of necessities in issues where we are dealing with quarantine requirements. We will grant funding to enable food scarcity as part of social intervention network. This intervention will include a rollout of 5 food banks targeting grant recipient clusters in all the regions or all our districts and metros. Going to enhance support for homestead gardening and promotion of gardening networks in schools. And we're also going to do food parcel distribution where the areas are found to be in needy spaces. And we are also going to establish low-cost healthy meal sales point in areas where food insecurity is a big problem, which will be run by qualified NPOs. We're also going to increase police visibility and community patrolling to ensure safety during these challenges, to make sure that people do comply with what the measures we have taken, particularly in terms of gatherings, of group gatherings. We also have made sure that all the public and non-essential meetings have been cancelled. You know that the upcoming human rights celebration in Sharpeville, the Easter celebration, sports and arts and culture events have been cancelled. And I think the Premier has already thanked the faith-based organizations and industry who have made sure that they accede to the call by the President. With regard to public transport, we are working with the taxi industry, which the MEC of Transport has started the engagement in terms of making sure that we are able to work with them to maintain daily health and hygienic grounds in terms of the taxi ranks and the railway stations. The taxis will be, in terms of the public spaces, there will be provision of hand sanitizers and soap and water basins for people to be able to wash their hands continuously or regularly. And also each mini taxi bus will have to supply hand sanitizers to their passengers for each trip, and that hand sanitizer should be adequate. Each transport mode must have sanitizers in their vehicle. That includes our own private cars. In terms of the trains, we also expect that the trains will have sanitizers. We also ensure that commuters will use the sanitizers when disembarking or getting onto their thing into the transport. The public facilities will be disinfected at least twice a day to cover the peak hours, and vehicles will be disinfected every after a trip. With regard to Gauteng system has been cleaned with alcohol-based disinfectant, and this includes the trains, the buses, and the stations. Cleaning with disinfectant has been carried out during the day and as well overnight to make sure that the trains are back at the depot and they are clean. The air ducts on the trains are being treated with disinfecting spray during maintenance hours, which happens almost regularly. Whilst non-essential domestic travel, particularly by air, rail, taxis, and bus, has been discouraged, we have to carry the message out supporting the Gauteng users working from home to not engage in non-essential traveling. Although this will impact on the revenue, it's necessary to reduce the risk for the spread of the virus. We have instructed our team to work with AXA to coordinate airport measures of messaging, sanitation, and ultimately discouraging air travel until the situation changes. We have implemented a decision to close all schools and early childhood centers as from the 18th of March 2020, and we are going to put sanitizers in all the entrance points in all the public buildings and facilities. Biometric system will be deactivated in most instances, and we are going to encourage usage of access cards for swiping to enter. We are purchasing gloves and masks, as I've said, for all our frontline staff, especially who provide essential service in order to protect them. We have decided that all workers showing symptoms or exposed to the virus or exposed to a person who have been in contact with the virus should stay home and seek help. We agreed with the municipality that from today onwards, all public facilities such as recreational facilities, community halls, swimming pools, camping site, museums, art centers, stadia, picnic and parks, braai and picnic spots, city sports field, and nature reserves will be closed from today. We also welcome and support the statement of NEHAU, which was made yesterday by urging government to procure more of the interferon drug, which has been used and found to be effective to treat patients with the COVID virus. We also insist that all of us must continue to just do the basics in terms of washing our hands and making sure that we are able to move forward. The provincial command team will meet regularly, led by the Premier, and receive reports from the different sectoral teams. Whilst these measures are in place, we urge communities to support one another in this time and in actual fact go back to the values of Ubuntu. We also urge you to continue to comply with the payment of services in the municipality, encourage citizens to use online services to do so and settle their accounts. We will also be assessing the impact of our plan so that we are able to win the war against the COVID-19 pandemic. We also urge the communities that they must continue formulate themselves. We welcome some of the communities like in Lodiam and in El Dorado who have already formed action groups around the pandemic, and we hope that this group will help us to even educate and make sure that we are able to put into place these measures. In short, this is what we have been put into place, and I'm certain that most of the things will then engage them as when we respond to the questions. Thank you.
I just want to conclude that there is another team of the Provincial Executive Council of 3 MECs. There's another team of the Executive Council of 3 MECs, MEC for Finance, MEC for Economic Development, MEC for Finance is MEC Ralehuku, MEC for Economic Development, MEC Musupye, and MEC for Education, MEC Lisufi. That team is looking at the two issues. It's looking at the economic impact just on the Gauteng economy of COVID-19. Our team at the Gauteng Growth and Development Agency has already produced a draft on the preliminary assessment of what this has meant on our tourism, on our various sectors of the economy. So that team is looking at on the impact on the economy. It is also looking at the budget implications. So if we are to do all these things, where are we supposed to reprioritize to procure, particularly the safety kits, the sanitizers that we need? We've got to go back to our budget and reprioritize. So that team will submit its report to the Executive Council early next week. In the meantime, procurement of the protective clothing and the sanitizers will happen as per various departments within their budgets. But this team that looks at the economic impact as well as the budgetary implications is going to finalize its work over the next 3 to 4 days, and Monday it will be able to present a report to us. And when we meet with business on Friday, there will also be issues around the full impact of this on business operations in Gauteng, but we want to call on business to cooperate with us, including township establishments, township business establishments where people gather during the weekend. We want everybody to comply. Funerals, we want everybody to comply. The one issue that is in these notes, MEC Mazibuko's team would like, I want to say to the people of our province, everyone who's applying for a funeral or for a wedding needs to do so at the nearest police station in your area. The police stations are helping us to monitor to ensure that the size of those events complies with the law. So there's a specific provincial police officer who is designated on behalf of the provincial commissioner, be coordinating all those applications, notifications for events that will take place at a community level, so that there is full compliance. So Tavo, back to you.
All right, thank you very much. I need a mic because we are streaming live. Oh, it's on now. It's fine. I need to use the mic because we are streaming live, so there are people who are not here, but who are participating in this briefing. So there are journalists who are following us through live stream, and I will start with one question from a person who is not here. And the name of the person is a journalist from Business Day. Claudie says she would like to know, she says, please explain in more detail what exactly you mean with regard to the downscaling of services to outpatients and the elective operations that we referred to, which we said for a month, and what services will be provided at the hospitals. That's the first question. I'm going to take more, and please just identify yourself and the media you come from. Okay, we'll start right there at the back. There's a mic there.
My name is Malunge Roboy from Newsroom Africa. I'm curious to know more about the family that refused to be quarantined. Can we get more detail on that? And also, how are health workers equipped to deal with such situations? Another question that I have, are we then going to have police officers patrolling communities in order to make sure that we adhere to that 100 group gathering of people, or we don't exceed that? And where will those police officers come from? Are we going to use from the pool that we already have? In terms of informal settlements, the Premier, you've already alluded that we live in a very densely populated province. Have we started with a campaign in densely populated areas to help them cope with this epidemic? Thank you.
Okay, thank you, Malungel. We'll go to the next one, Griselda. Okay, is there somebody at the back? No. We need those that are following through live streaming to also hear.
Good afternoon. I'm Griselda Lewis from SABC Television News. Either Premier or the Director General, I received an SMS this morning from one of your employees at the GPG buildings complaining that there are absolutely no measures that have been put in place as yet. How soon will we have these measures put in place? They're feeling a little bit unsafe at this particular time. Also regarding the Gauteng couple that ran away, do we know exactly why they did that? Was it for religious reasons or what happened? We'd just like more clarity on that. And also with regard to Gauteng being the highest number, I just calculated it's way over the half mark in terms of the cases that have been reported around the country. Premier, that should certainly be of concern to you as the Gauteng government. What further can be done in addition to that? MEC Masibuko, taverns. We're heading fast towards the weekend. We know South Africans love to have fun. What about the taverns? There certainly needs to be something put in place there, apart from just regular patrolling in dealing with the taverns where you have a large group of people who are out to have fun there. Thank you.
Okay, did the person indicate which government building? You don't have to mention their name.
Yeah, Umnoto House is one of
Umnoto
them.
House,
The
okay.
biometric system is still operating there.
All right, thank you.
Kenny Mapanga from News 24. This question is for the Health MEC. Under what circumstances would you reconsider your stance on mass screenings? And could you please give us some more details, the guidelines that you're using to decide who and who you don't test for the virus? We've had some complaints with people who are displaying flu symptoms who have been turned away because they didn't have direct contact. Can we have more clarity on what these guidelines are? And then please could you explain for families, in light of this Gauteng family that ran away, how are you ensuring that families are self-quarantining when they are in spaces, in their private spaces? How are you monitoring them? How are you ensuring that they're not in contact with members of the public? Could you give us more details on that? Thank you.
Thank you. Let's answer those. We will come back for another round.
I've worked in highly infected spaces, and I'm still here. I think I'll start with the basic difficult questions. You know, the issue of mass screening doesn't make sense in terms of resource aspect of it, and it also in terms of getting what you really need, because you're still going to have to screen a lot of people for you to get fewer contacts or fewer people who are infected. And I think that's not logical, and I don't think that's rational. So we still have to stick to the basic
rule of screening, which would be that you should have contact, you should have travel history. Because if you don't have that, like myself, I've not been outside any, and maybe I've not been in contact with anybody, then I shouldn't be worried, because we still have to, I've said it before, that a man who's got nausea and vomiting symptoms in the morning doesn't equal that he has to go and seek a pregnancy test, because that doesn't make sense. But we still have to have logical approach to all this. And yes, indeed, we need, because of the increased number of contacts, transmissions, at the moment, the 116 that we have, we still have got less than 10 people who have received, who got infected through community-acquired HIV transmissions. We have not got to a point where we've got a number that is growing out of proportion in terms of that. And the majority of the people that are infected are still those who have been to the areas where the infection has been high and the outbreak has been high, which is USA, UK, and most part of Europe. But one of the things that we are going to do is that we are going to make sure that we give almost everyone, starting with the most vulnerable, flu vaccination, so that at least we are able to cover that base and get what we call herd immunity, to make sure that most people get immunized and vaccinated against common flu. Then when we have somebody with symptoms, then we know that it's something that we might need to take serious, and if it comes with positive responses on the screening questions, it makes it easier for anyone to follow it in terms of the medical patients. So our elderly population will be duly be vaccinated. Our pregnant women will be duly be vaccinated, and the children will be duly be vaccinated. We're going to start with the most vulnerable group, and we are procuring more stock in terms of flu vaccination, and it's something that we normally do annually, but I think now we're going to try and cover the group in essence. We have 249 tracers currently. We are aiming to build the capacity to almost 1,000. But we also are going to train our community health care workers, because already we have them in the system, and already they have got experience in terms of tracing, in terms of tracing HIV and AIDS patients, in terms of those who are tracing those who are on TB treatment. So we are going to use the cohort of health workers that are there. They will be trained to scale up to an amount around 1,000, because the availability of tracers makes it easier for us to be able to do proper containment strategy. So the tracers will be important. So the community health care workers will be the one that are so much important in this space. The number that we have of community health care workers that we have in our system, in our personal system, is almost 9,000. So we are hoping that we are going to utilize some of them, but if possible, in terms of training, because we still have to train them, So because of the 100 restriction, we might not be able to train them at once, but we'll continuously do that to escalate our response. And the issue here also is that the response that we are giving, it's not something that is perfect at the moment. It's going to be continuously be escalated as per response and as the situation. The issue of the informal settlements. The informal settlements, we're still going to use community health care workers for the education, and that's why we also encourage communities to start action groups, which will help us to disseminate accurate information, which is not related to any fake news. And when we talk about informal settlements and even the families that are self-quarantining, remember, at the moment, we still have got a greater population of people who have been infected, who are almost, we can say, affluent. But the issue is that these are people that can comprehend the methods that they have to take. They have got access to resources that can be able to do. So that self-isolation has been quite perfect up to now. But yes, we are monitoring the situation, making sure that we are almost ready for when we need to remove somebody from the community to an area where we are going to be able to quarantine them, particularly areas like informal settlement and townships where self-isolation and self-quarantining might not be possible. And I think that's where we are. Currently, the tracers are the ones that do the monitoring of how it happens in that family. The question on how we are going to talk about. So when we talk about downscaling, we're talking about almost putting the system almost at rest in terms of services, so that we don't deal with a lot of pressure in the system. So it's what we do normally over vacations and over holidays, particularly holidays like your festive season, because that's where we cancel or we postpone or put into abeyance operations that are not essential, that are not life-saving at that time, and also the services that are not going to be required that will save life at the time. So when we talk about downscaling, that's what we are referring to. It's a mode that we all normally do on festive season, but you will know that even if we go at rest, our emergency response still comes up because we have to be ready at trauma level in terms of trauma that we see during holidays. So downscaling services, that's what we are saying, and we are advising our clinicians and that they should give us a way and how they can do things in terms of making sure that those who will require regular checkups, how they will space them up and putting up systems. But this won't be the same in all facilities. Each facility will come up with its own way of how to sparse and make sure that we don't get overcrowded spaces like our outpatient departments. The last question that I will answer is the issue of the family that refuse quarantining. The issue here is that this is a family that we still have to maintain their confidentiality and privacy because we don't want to continuously create, or some of the information that if we give out will create a stigma and will send out a wrong message in the public. One message that we want to send with this family is that, using this family as an example, is that we expect the public to cooperate with us in terms of how we are going to be working and containing the disease process. So we want to maintain their identity confidential, and we want to maintain the issues that relate to the circumstances a bit confidential, because we don't want to send out a wrong message about it. Yes, indeed, we are over 50, so the response that we are putting up, even in terms of the plans that we are trying to develop or that we have currently and we are working on them, we will be able to deal with the situation as the disease process escalate. One thing that, before I give the Premier the opportunity, one thing for certain is that after lockdowns or after drastic measures are taken, usually the disease process slows down. And countries that didn't do drastic measures, they had an upsurge of the infection. And countries who did them like a week from what China did, most of them didn't have an upsurge in terms of infections. And those countries are the countries that we are emulating, and that's why we also persuaded our government and our national government to actually take these measures so that we are able to maintain and make sure that we don't have peaks of the infection. Thank you. It's a struggle, this one.
Thank you, MEC. I want to emphasize that we have a huge army of community health care workers, 9,000 in the province. Our health department is retraining or training those workers to be part of the tracing teams, but also to give them the information. There are our troops on the ground to give those community health care workers the basic information about coronavirus and what families and households can do. As South Africans, a grassroots-driven campaign is something we have done successfully on HIV and AIDS. On Friday, we had the Gauteng AIDS Council, where one of the issues we briefed the AIDS Council on is the outbreak of this pandemic and the lessons we can draw as a province from how we mobilized communities, various sectors of society to respond to the epidemic of HIV and AIDS. So one of the additional resources we have, our AIDS committees across Gauteng, we have AIDS councils in every district. We also have local AIDS councils. We have activist committees in various communities. So we agreed on Friday at the AIDS Council that those structures, because it's very important to understand that the lessons we have drawn in confronting, reducing, we know HIV and AIDS is still a big problem in our country, but if you look at where we were from the mid-2000s to now, through action and social mobilization, community activism, and many NGOs coming together to get the message out there, we were able to make some significant gains in many areas, including on the prevention of mother-to-child transmission. Our province is at 0.7, from 9.3% to 0.7%. And all those are the lessons around community mobilization, but accurate information and education. One of the problems with coronavirus at the moment is that there's lots of fake news and people just don't understand the basic thing. The level of knowledge and awareness on HIV and AIDS, including what to do once you are infected, is very high in our country. People know you need to eat the right type of food. That information is now in the hands of citizens. Those infected know that. Also destigmatization. One of the things the provincial government is worried about is the stigma of coronavirus. If you ask me, there may be many reasons why the family acted the way they did, but I know that stigma is an immediate issue. Today, when you are in a public transport system or you walk past someone and they cough, people take cover. But it is important that when you have these symptoms, you know, you take steps to know. Because once you know, there's a set of actions that can be taken. And that's why we also think that part of our dilemma, I explained that communities are rushing to hospitals in large numbers. It creates a crisis for our facilities. But at one level, it's a good thing, because it just means since the president spoke on Sunday, the level of awareness is very, very high. But our people need to know and not respond in a panic fashion. And we want these community health workers to take information to communities about what is it that can be done. These activist groups, action groups, we are drawing these lessons, community action groups, we are drawing lessons from the fight against HIV and AIDS. Sending information out, printing pamphlets, putting information in public spaces. We are drawing lessons from the fight against HIV and AIDS. Knowledge is power. When people have information, they can act correctly. They will act not in a panic mode. But we're emphasizing community mobilization. So we will reach people in the informal settlements, in the townships, through these structures we have established as we were fighting against the epidemic of HIV and AIDS. So those structures are going to be very important vehicles for us to reach out. The DG will deal with the question about the government buildings as a specific area of responsibility that she has. But I want to emphasize that we want communities to cooperate. We want citizens to cooperate. We want businesses. We want those who are owning shebeens in our townships, who are running catering establishments we want them to cooperate. But one of the things that the team we were looking at as the Gauteng Executive Council is that this pandemic is a crisis. Yes, it's a tragedy. There's loss of life globally. There may as well be loss of life even in our country. But it also gives us an opportunity to sort out generally the things we are supposed to sort out. The state needs to take charge of its borders. So border control measures that have been introduced by national government, we welcome them, including the closure of some of the borders, but making sure that the state can account for everybody who comes into our country. They must come into our country lawfully. They must come into our country. Whatever gets brought into our country must come into our country. Any state of integrity would take measures. So these measures, whether it's about border security and border control, are important. But also we want to strengthen our public health system. So this is something we need to do in any case. So this pandemic also gives us an opportunity to ensure the public health system can reach all our citizens. We're able to reach them. We also want to be able to trace. There are many TB and HIV patients who don't often take the medication as prescribed. And what it does, it creates bigger problems for us. So these tracing teams that are helping us to trace the patient, the people who may be identified as those at risk. These tracing teams, we are strengthening the capacity of the state to trace all the patients who are on our treatment regimes of various diseases. Some of them disappear, some relocate, they move out of Gauteng to the rural provinces. They come 6 months later, they have not been taking medication. So basically, this is the job for a healthcare system to be able to function optimally. At crisis moments like now, and even at normal times, when we talk of the capacity of the state, it's not just rhetoric. It's not just some ideological claptrap. When we talk of the capacity of the state, we mean so. And this moment prevents us with an opportunity to step up. And for many who are out there, they can see that various levels of government are stepping up to address the things we are supposed to do in any. Occupational health and safety. The safety of workers who work for government is our responsibility at all times as an employer. At crucial moments like this, but also at normal times. So that is the reason we are taking all necessary measures to address the issues of concern as it pertains to occupational health and safety. Not just for this moment of coronavirus, but also at all times. And the DG will just deal with the issue of biometrics and other areas that may be of concern about whether we are stepping up or not. The doctor will come and help you first.
Thank you, Premier. Good morning, ladies and gentlemen. On Monday morning, all HODs were instructed to ensure that we provide sanitizers for all our buildings at critical points. And you can imagine the instruction came on Sunday afternoon. So we were still working on obtaining. So some buildings got them faster than others. I am told that Umnoto House now has sanitizers at entrances. To mitigate over the last 2 days, they got cleaners to clean a little bit more frequently. The issue about biometrics is that it was essentially about the safety of staff, their goods, their belongings, and the belongings of government. We are working on a system of reverting to cards, access cards, as well as access tags in order to mitigate the issues of infection. But overall, there's a whole plan based on the circular that was issued by the Department of Public Service and Administration that we are in the process of implementing as the Gauteng government. And yesterday we met with all the occupational health and safety officers to ensure consistency and collaboration across the Gauteng government. And it will be applied at head offices as well as all other offices, regional offices and health and all facilities where government services are provided. Thank you.
There's one question we forgot to answer, Malungelo boy. Malungelo, we have metro police in the 3 metros and the South African Police Service. So one of the important points I want to keep emphasizing is that we want people to do the things they are supposed to do in any case. Those employed and paid to do this work. So we have Metro Police, we have the South African Police Service. The Metro Police normally police at that level, at community level. They support communities for various events when there's going to be a funeral. They do it in any case. The South African police station, SAPS police stations, there are many things that they used to do, but some have stopped doing, including when there are events in the community. It is normal that the police know there's going to be an event in this community because they set up what is called JOC, so that there is emergency service. If there's going to be a marathon in a locality, there's going to be a funeral in a locality, there's large number, there's normal things that are supposed to be done, but yes, some of these things were not being enforced. They are not supposed to be done, or they are not done as they were supposed to be done. There are bylaws that are supposed to be enforced around when you want to have an activity in an area. You need to notify the authorities and apply. For every hall, community hall that is used, you need to apply. So what we're saying basically is that the state must come back. This is about ensuring the state comes back to do the work it is supposed to do. I'm saying right from borders, security, to community level cooperation and compliance about this is how things must be done. So these things are there. They are standard requirements. Often they don't get done because people just think, it is, they can just do as they wish. So police stations, metro police departments, our traffic departments everywhere in the province, including municipal traffic departments, the South African Police Service, those employees of the state's job is to ensure at all times that there's compliance. So they will be doing their work. If you say, where will we get them? They are there. The police stations, there are 142 police stations in Gauteng province. They are located across the province. We are even adding mobile police stations in areas where there are no police stations. And we have a huge force multiplier of metro police departments that are there, traffic departments in municipalities. Through Ukai Mulao, we have actually been getting back to do the work they have to do. And I go everywhere with the MEC for Community Safety and the Provincial Commissioner. We get in these police traffic departments of municipalities and metro police to do the work they are supposed to do. And then at a provincial level, the South African Police Service leadership then comes to just provide support. So that's the point I'm making, is that the state must return to be the state. And we want citizens to be activist citizens, active citizens. We can't succeed in overcoming this pandemic if citizens are standing by or they are not doing their part. Families, households, everybody must take steps to ensure that we succeed. We save lives. We avoid what's happening in other countries already. South Africans have an activist spirit. Grassroots organizations can crop up everywhere to deal with this pandemic. We want to call on retired doctors and retired nurses across the province, in every community where there are retired health workers. We want them to come back in their communities where they are. We want them to join these action groups to offer their skills, to offer what is their remaining energy to the nation in confronting this. So mobilization and activism is very important, but the state must enforce bylaws, it must enforce the laws. This national disaster declared by our president must be enforced by all of us. And I want to emphasize, we appreciate the leaders of many big organizations have already come to party to say they will cancel their events, they will reschedule them, they will scale them down, and we appreciate that. But as the state, we have to do what a state is supposed to do. We have to shape up. and do our work. And citizens are already doing a lot in this regard.
Okay, let's take the questions. I know Priscilla wants MEC Masiko to talk about taverns. We'll deal with that at the end if the MEC wants to comment. I thought the Premier did cover it generally when he said all these measures as part of the disaster declared by the President will be enforced. But if the MEC wants to comment, she will at the end. Let's take the last round, and I will appeal that let's try to be short so that all of us, all of you who want to ask questions can have an opportunity. Let's start this side now, and we'll finish that side.
Sarah from the Mail and Guardian. Some people have raised concerns about the lack of access to water in places like Hammanskraal, where residents have complained that they don't even trust the water that is delivered them by water tankers. So how will the provincial government assist so that those residents can actually wash their hands? Then my second question is, how many hospital beds does Gauteng have presently, and how many hospital beds is the province looking to procure?
Hi, my name is Tabitha from SABC Radio News. Ekurhuleni Mayor Mzwandile Masina has just announced that he's procuring a vaccine and other related medicine from Cuba. Are we aware of that? Is that what the province is going to be doing? People are also complaining about the high cost of testing for coronavirus. Are you aware of the long queues? Is there anything you can do to assist those people? And are you encouraging people to test voluntarily? And the last one is, when will you start installing our sanitizers actually in hospitals? Because apparently in some hospitals we still don't have them. Thank you.
Do you need more?
Thank you. My name is Nick Ende. I'm from the College of News. Prima, it's almost 1:45 now. If I may ask you one easy question. What's the official latest figure of people hit by this virus as we speak now? Right. And then question 2, you spoke about additional facilities. So I need clarity on that one. Are you still going to look to identify those facilities for quarantining people or admitting numbers? Or you have an idea as to which, this and that and that and that? And then last question, you just made a hit and run statement and say that you're calling out all the retired nurses, doctors, but you forgot to mention whether they'll be working pro bono or you'll be paying them. Thank you.
It's Daizo from Power News. Just a quick one. With regards to how you are going to grant or deny those that go and make those applications, is there any criteria that is needed that you will consider when a person says, I'm going to have a gathering of that sort? I just need clarity on that, please.
Good afternoon once again. Because Gauteng has the highest number of infections, I have to ask, how many are critical? I know there was a critical instance once, so if you could elaborate on that, please, MEC.
Hi, this is Kelvin from ENCA. Premier, are you able to say how many people have been tested in Gauteng? MEC, you've contradicted the transport minister. You're saying that screening should be done to people who've come in contact. The transport minister is talking about random screening at taxi ranks. Are you going to implement the random screening at taxi ranks? And then I understand that the laboratories that are testing the samples are overwhelmed at this point. Do you have any plan to give them extra capacity? And at which point, Premier, would you be releasing the names of the towns where the cases are happening within Gauteng, which suburbs? Because people want to effectively practice social distancing, but the updates from the National Health Minister only gives it by province. Thank you.
All right, thank you. Bring the mic here for the last question. Last.
Mohammed from Radio Islam. Till now, we've been having bad news about all the numbers that's going up and up. Have anyone been retested and come out negative, or has anyone gone back saying that they've been cured?
MEC Maile will deal with the water issue and municipalities, and how is the city of Tshwane preparing for this, all these measures. MEC Mazbuko will deal with the issue of gatherings and what is the standard procedure for applying for gatherings and the criteria for that. There are a lot of questions that will be dealt with by the MEC for Health, because these questions have to do also with what is the standard application and approach by health professionals, because we don't want to politicize matters that health professionals deal with in a particular way. Let MEC Maile start and then be followed by the MEC for Community Safety and the MEC for Health. I will deal with the announcement made by Mayor Masina.
No, thanks. I won't be long. Kevin and Tshwane, you will know that there's still a council there until Friday, because you want me on record? You can quote me in passing, it's fine. No, I'm saying you know that there's a council is still in office, council, until Friday. Then there's processes that the NCOP is busy with, and they will pronounce themselves tomorrow. But between now and Friday, what we will do is to issue directives. As you know that they are still under Section 139, subsection 1, subsection A, meaning we can issue directives. We had long issued a directive about the water situation in Amanskraal. We will issue an Agent 1 now, today, to ask the senior management that is there to ensure that they attend to that issue. Not just Amanskraal, there's other areas affected in the Bronx-Spruit area. So we would want them to do that. And then from Monday, we will have an administrator who will be responsible and who will make sure that they attend to the issue. I think we should be able to announce that administrator by Sunday, whenever, Premier. We will be able to at the right time. In the meantime, there's going to be a meeting on Friday, convened by the Minister of Culture. We will then be able to post that meeting to deal with how we are going to work with our municipalities in the province and national, so that there is a coordinated approach in dealing with this issue. I think that should be sufficient. Thank you.
Asithela ngentelezi. MEC Masuku sithela ngentelezi. Thank you very much for the question, especially on taverns. I had to consult with the MEC and the liquor board to say, because police just deal with enforcement, and that people must comply also with their licenses. And from the response that I'm getting from the CEO is that they have been engaging all the tavern owners, and they've agreed that those that serve liquor, whether you are a shebeen or a tavern, they must make sure that they do not exceed the number of 50 patrons at a serving time. And they have agreed that the distribution and consumption of liquor or alcohol weekdays shall be ended at 18 hours. So kushukuthi ayikho ilala vuka anymore. And Saturdays and Sundays, the bottle stores will adhere to their normal working time of 13 hours, and those that then serve locally also will have to adhere to those hours of 18 hours. And they said they are continuing to engage, and they will be promulgating this in time for them to actually be implemented. So for those of us who like to go to Lala Vuga and clubbing, on the issue of people gathering, it's a standard procedure. It's in line with Gatherings Act of 205 of 1993. There is a law that has been promulgated for people when we gather. Each time, whether me and you want to go and picket or want to gather to have an event, we have to apply. But in this instance, as Premier has indicated, we have agreed that capacity must be built at local police stations level so that people can go to their local police station and be able to inform the station commander or a designated policeman or a woman that they will be hosting a funeral, and that they'll be hosting a wedding, noma umcimbi wamadlozi, noma sizobe sigida siyizangoma. That must be information that must be known by the local police station. But over and above, we do have community patrollers, we do also have CPFs. So don't think you'll get away with it. Definitely, they will inform the authorities that a number so and so kuhlangene abantu. And what I like also is that even your neighbors will also tell us, they will tell us that no, lie next door, and then we ask the address, they send us address, then the sector police van or the local MPDs that are within that area, they will actually go and investigate, and even the district officers that do exist in West Rand and CDB, they will then go and investigate and be able to determine if you are complying with that. Already we are getting complaints about a certain church in Sharpeville. They've been gathering since Monday. We've sent in police there. They're already getting complaint about a certain school in Zakaria Park. We've sent police there to go investigate. And the church in Katlehong, the famous church, MEC Masuku promised me that the clergy there, Abangan back, he will go talk to them to say they must start reducing the numbers, because these are pilgrimages that are always held. We know them, but we are continuously engaging with them. After the meeting with all the church pastors, by Friday that Premier will be hosting, we will actually be issuing all notices to all of them to indicate that they must also comply in relation to having 100 members at a time. Luckily, some of us are Sonte Zion, Sonta si 20 receive food. So probably Tinanga Slupege, Umanga. But wish to urge people that these are done in line with the directives that we've received, and we really wish our communities can please comply so that then we don't end up having to enforce using force on them. But I'm 100% sure most of us will definitely make sure that we do comply. Thank you, Siabo. To Masuf. Yes.
Okay.
Okay, I'm just going to cover most of the questions that deal with the science behind the thing. The procurement of interferon is something that has been happening. We have it on stock. It's not really a vaccine. It's a protein particle that has got antiviral properties. It has been used in many instances under a directive of specialists. So it's something that we do have. The issue is just how we are going to, when we require it, we are going to make sure that there is available stock. Currently, we do have stock in our MSD, but it doesn't mean that it could be enough. And it doesn't have to underplay the messages that we've been putting across, that prevention is definitely better than a cure, and it's something that we do and we will continue to do. And currently, we have to be clear that there's no vaccine against this virus, and it should be known to everybody. So when people talk about vaccines, we need to talk about it with a tongue-in-cheek. I think we've seen several countries announcing their discoveries, but we know in terms of facts from the World Health Organization that we're almost six months to a year away from a registered vaccine that could be allowed. The issue of, I think MEC Mazibuko has covered it. Non-essential gatherings means exactly that. Of course, we can't postpone a funeral, in other instances, maybe you can, but we need to make sure that the non-essential gatherings should be avoided. And we need to talk about very clearly that the enforcement of social distancing is quite important, and it shouldn't be taken lightly. And this, just to use the enforcement that we have, we are going to enforce it. I think we've been fortunate enough not to have really sick patients. Most of the patients, they actually fit into the disease pattern that we have observed internationally, that 80% of the people who get infected, they have got mild symptoms, and they normally recover quite quickly. And then in the 20%, we get those who normally get severe thing. But maybe with the numbers going, touching wood that we are not jinxing ourselves, we don't get to the point where we get critically ill patients. So we have not had any patient that had required any ventilation. We won't be able to mention the towns and suburbs because that's also contributing to stigma, and also how people are going to respond and react to panic. So I think just to maintain a bit of calm, we need just to say that everybody must apply the same measures throughout. There's no part of the country or part of the province that will be immune from it. I think we also have to dispel the myth about Africans and blacks that they don't contract it. That one, we know that the virus doesn't really care about how you look and who you are. It infects everybody, and it's a standard thing. So if you don't take care of yourself, you don't protect yourself, in many instances, definitely you will be dealt with by the virus. The last questions are on retesting. I think this is just what we have read on journals. I think you know that every day there's almost 400 papers, on novel knowledge on corona natural virus or the SARS R2 that we are talking about. So there are instances where they talk about a person who was said to be recovered, and when they did a test and they actually went back to be admitted, mostly actual critical. But those are still instances that we talk about them only on journal and academic articles. Then it's not a common occurrence that has been seen. And I think the issue of curing, we need to be very clear that like all other viral diseases, the issue is that the antibodies that you have must kick in. So the treatment and management that we institute is mostly supportive, meaning that when you've got pyrexia, low fever, we give you something that will drop your temperature to make sure that your body proteins and enzymes function at the optimum. And then we are able to, if you have a lung infection, which is severe in the case of the COVID-19, we give you extra and supplement oxygen. So the issue is to optimize your body to be able to produce its own antibodies that can be able then to deal with the infection. So in essence, all the drugs that we've been using and trying, you know, some of them off code. They've tried the chloroquine, which is a drug that is used for malaria, which has found to have some impact in making sure that your body responds properly to fever and your malaise, and so on. So those are things that we're looking at, but most of the patients have actually survived. There's an article that came out this morning about India packaging a concoction which includes some antiviral drugs and antiparexic drugs that have to work, including chloroquine. So those are things that we need to know and appreciate. And then the additional facilities have already been, we have already created enough space in our facilities, particularly outside to those who have been earmarked, Charlotte Makleke, Tembisa, and Steve Biko. And one thing that the Premier said, that one of the things that we are using this outbreak for is to continue to empower and create capacity in our health system. So even after the outbreak, most of the facilities that have been identified would have more capacity to deal with the thing. And outside our own facilities, we are in touch with the private sector when we are in discussion with them, and we'll deal with it as we come to it. The cost of the tests, they are almost private. Most of the costs are actually it's private companies that do that. I think last week it was 1.2. This week is 1.4. So seemingly, you know, the scales about demand. You know, I think the issue of profit and scale always come into picture. But the minister is meeting today with the executives of all the laboratory groups across pathology labs across the country, just to talk about, first, the cost of the testing, and secondly, sticking to the criteria for screening on even doing the test, and thirdly, just to quality assure actually the test. And in the point of doing quality assurance of the test is to make sure that everyone who get tested, we validate the test, and it should be by the national laboratory. It shouldn't be anyone after you test, then they just give you the thing. We should be able to validate and make sure that tests are quality assured. So those are things that we're trying to close gap on. And remember what I said when we started, that all the plans that we have, they might not be perfect now because we are at the beginning, but at some point we will be, when we say we are at optimum level, including the issue of giving enough protective equipment and everybody to be covered, including sanitizers. But sometimes it becomes something that is superhuman to be able to say we declare today and everything else will be perfect tomorrow. So it's something that we have to go through, and we are committed in escalating our resources and our response going forward. Thank you so much, Premier.
Thank you so much, MEC, for that comprehensive response. The MEC also, you would see that he also gives a scientific and medical response. That's why we don't want to do what we did when we dealt with the HIV and AIDS pandemic and play some politics with what is basically a pandemic that we must confront. That's why we must talk to all political leaders. That's why we must talk to all civil society organizations. That's why we must be guided by science. That's why we must be guided by medical. Our best, South Africa has got lots of talent. I know our province has got some of the best medical specialists, including virologists. Some of them, I met them at Charlotte Macleke. They meet there quite regularly. So everything we do, even in the province, must be guided by science. So I'm saying this because you would understand that if you... So the first thing is we must strengthen the national response. So these measures we are putting in place in accordance with us is to strengthen the national response plan and to implement the national response plan that was announced by our president, that's being led at a national level by the interministerial team. We are not moving in our own direction. We are strengthening that to contain the spread. We are one country. I will be very reluctant to entertain any city that thinks they must do something else outside the national response plan. I'm saying any city. It doesn't matter whether it's a city governed by the ANC or governed by any other party. We need to strengthen the national response plan. And we must be guided by science. So Dr. Masuku emphasized this issue that interferon is something that has already been in use. That's how we're dealing with the issue. But science will tell us, and our experts will tell us, as the province and as the national government, what more needs to be done. The head of the World Health Organization said, the best way to deal with this pandemic is to do everything, all the measures. Not one measure works. We must do this and this and this and more. But I just want to say that for a municipality that thinks they want to do something else, we are the Republic of South Africa. There's no Republic of Gauteng, there's no Republic of Ekurhuleni. We are the Republic of South Africa. Everything we do ourselves will be guided by the national team, even in Gauteng. So I want to discourage any idea that a municipality can do something else. So that's why even our team, when the MEC comes back and say, the scientists are saying, we must look at this intervention and this intervention. So one of the problems during the HIV and AIDS, when we're dealing with HIV and AIDS, is to allow the populist politics to override the scientific response. So I want to discourage that. Gauteng municipalities must know we are part of the national response. Let's strengthen the national response. There was an issue there about the health workers. It's just that you are dramatic all the time. You just miss me. You just missed me. You were very dramatic in the issues you raised. The health workers that are retired, who we are calling upon to come back and assist, is part of the community response. It's part of the volunteers that we need. When there is an outbreak of the pandemic or an epidemic, you have to source out also community volunteers. So it's part of the community volunteers. There are many sectors where we are going to need community volunteers, professionals in various sectors who may want to come to the fore. We want them to do so on a basis of volunteering as a part of our comprehensive response. So we will continue to brief you when there are new developments, but I want you to know that we're working under the guidance of the national team. Gauteng is hardest hit. Dr. Masuku didn't talk about the latest figures. You know them. They are out there, announced by the Minister of Health. 85, unless if there's in the last few minutes there are new ones. Now there's 116 since we're here. We are 61. So because this is developing all the time. So as we were coming here, we checked the numbers. So as we were here, sitting here, new numbers. But all we are doing is to ensure that as Gauteng province, as a province that's most vulnerable for the reasons we have explained, we do our best to strengthen those measures that our president has announced. So thank you very much, and we hope you yourselves will help get this message out there. Thank you very much.
Okay, thank you. We've come to the end. Later